I am on Facebook Live. All right. I'm live. So, hi everyone. This is Dr. Thomas Chacko. I'm an allergist here in the North Atlanta area. I want to do a Facebook Live now because I've been getting a lot of questions. And I think it's best to maybe try to answer them live or as in one large forum versus not. As we know, we are now staying at home. Our office is open, but we do have limited hours. We are giving allergy shots, but we now have people to try to limit people's contact and keep the waiting room as empty as possible. We have people waiting in their car, and then we call them up to get their allergy shots, and they then again wait in their car. So we're doing portable waiting rooms, I guess you could say, and having them wait in the car and call us, or actually rather than call us, text us when they're in the in the parking lot, and then we have them come up. So we're trying to do our best to take care of our allergy and asthma patients by giving them the allergy shots that they may need, especially in this high pollen season, but still with social distancing and having them wait in their car, and then afterwards also wait in their car. I did get a question from one family in my coming office about how we share an office with the primary cares, and with that we are also having people wait in their waiting room, text us when they come in, get their shot right away, and then go back in their car to wait. Again, trying to limit our exposure to patients as much as possible. Another question I got with the COVID outbreak and asthma, and are those patients at higher risk than someone else? And the answer is yes. Anybody with any type of chronic condition, any respiratory condition, will be at a higher risk, that's for sure. The issue with asthma, though, it's a spectrum, right? You could have mild asthma, or you could have really bad asthma using steroids, being in the hospital, or you just have asthma when you exercise, or asthma in the springtime, and otherwise doing well. So when you ask, are you at a higher risk? Yes, you are at a high. Asthmatic patients are at a higher risk than the general population, but it depends how severe your asthma may be. Someone asked me that if they have asthma, should they still be able to be outside with COVID going around, people going around? I'd still say, yes, you can be outside, just don't be next to people, social distance. If you want to go for a run, that's okay. Just make sure you run and you're not close to people. Still, I am a very, 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 very big fan and strongly recommend the social distancing. We have only seen my immediate family and no one else. We go outside, we go to the park, we go to our neighborhood park, we play tennis a lot. We take our dog for a walk a lot, but we don't see other people. So the question was, if you're asthma, are you at a higher risk? And the answer is yes, you are at a higher risk, but it depends on how brittle your asthma is, and that would determine the risk. Other questions I had were, what should we do with the pollen season now? And with COVID? Well, you still should socially isolate yourself, but you still need to take your asthma medicines. You need to take your inhaled steroids. The questions are steroids safe? Your inhaled steroids, your topical control of asthma medicines, now it's more important than ever to be on them. So make sure you take your control of medicines, whether it be Advair, Flovent, Qvar, whatever they may be. Make sure you're taking your regular asthma or allergy control of medicines versus missing them. That would make a big difference if you coming in the hospital and being flared, or coming to the doctor and being flared. Because a lot of people, if they take their medicines more regularly, will prevent them from asthma being flared. Taylor, I'm trying to think. Other questions have you had from patients coming in?
We've covered them.
The biggest question they ask is, are we open? Yes. I think people need their asthma medicines and their allergy medicines to do that. Another question I had was, and I'm going to get to that. I see a question as, can pollen cause sinus infections? And I'm going to get to that one. But the biggest question is that we've been getting is, are we open? Are we giving shots? We are. We are giving shots, but we're limiting. Hey, John, how are you? I do see another allergist watching for me, an allergist in Philadelphia. Good luck with your family, John. I hope things are going okay. I hope the practice, and more importantly, everyone's staying safe. I do want to let people know from a practice point of view, I do run my own practice. We are a small business. We are not seeing very many patients. Business is going to get hurt. I am okay with all of that. Please stay home. That's more important. Everybody wants to, get the economy going, and don't, please, I agree. But the biggest way to keep the economy and everything going is staying home and being safe. I actually, my parents are in Queens, New York, actually, where it's really, really, really bad. So I ask everyone to please stay home. Our office is open. We are not seeing many patients, except those that need to come in, and that's how we want it to be. We are offering allergy shots, but limiting their exposure, again, having people text us when they're coming in. The question was, can pollen cause sinus infection? Someone texted me that. The answer is yeah. They could cause sinus. They can make your sinuses get worse, inflamed, and then lead to inflammation. People always say infection, and that's there, but it's not necessarily always needing antibiotics. So people can have exacerbations of their sinusitis during the pollen season easily. How do you prevent that? What do? You watch the pollen counts. You go outside when the pollen counts are low. You go for your daily jogs, maybe in the evening versus in the early morning times or noon time. The pollen goes up higher in the mornings, 10 a.m. to 12 a.m. or 12 p.m. or noon. Try to minimize your exposure. Instead, go at 7 o'clock. It's cooler down here at that time anyway. Go outside during that time. It's not as nice. It's hotter in the morning. The other thing, how do you prevent the pollen from causing these sinusitis or sinus inflammation or infections? Use that neti pot or those saline rinses. Use that. Very natural. Very, very natural. For those guys who don't want to take medicines, use the rinses. Rinse out. Get the pollen out. Get the mucus out. Get the infection out. Get the bacteria out. And then use your nasal steroid afterward, whether it be Flonase, Nasonex, whatever it might be. They're over the counter. You get them from Amazon. Rinse out your nose. Use the Flonase. That probably gets about 60-70% of people better. That's one of the best things you can do. Hey, Regina, I got a lot of Philly people here. You guys, at least you're all staying home. It's Usha's family and friends from Philly. My other question, I know Chris, who I just saw this morning, was telling me that this morning his buddy, who lives in Georgia, probably somewhere around here, asked him to come over and have a beer with him, to hang out, have a barbecue, have a beer, because we're home, right? And I told Chris that I don't know who your buddy is, so I'm like, I think that's a bad idea. I would not go and have a beer with your buddy. I would say this Friday, I had 5 or 6 other doctors, all guys around my age, probably early 40s to mid to late 40s. We're all doctors, at least 5 out of 6 of us, wanted to get together. We haven't seen each other for a while. We're all cooped in. We were going to get together, and then I texted them saying, I will only come for a drink, and we're going to be around each other far away if the primary cares agreed to go. And all the other primary cares were like, no, we are not meeting. We decide not to go. It's not safe. It is not worth it. So I could tell you that's what I do myself. And I'm that guy that always likes to be around people. I'm pretty social. I like to have drinks with folks. And so I'm telling you, that's what we did for ourselves. Instead, what we did was Friday night, literally you got 5 or 6 grown physician men on that house party app. House party? It's some app where we all had drinks together. If y'all are personal friends, you can see it on my Facebook. And we virtually had a happy hour. I'm doing that. My wife is doing that. My kids are kind of doing that without the happy hour aspect. But my point is, stay at home, guys. I know some of you guys are in Philly. Stay safe. Please stay. I know you guys are already staying at home, but we at Georgia and we in Atlanta don't want to be New York. That's the problem. I don't think we're taking it safe enough. And so I'm trying to tell people to stay at home. Make sure, someone just told me do Zoom, not house app. You might be right. I feel like Zoom is more professional than house party. But Marianne in New York my cousin Marianne's on the line. She knows, she's in Queens. It's craziest there. Again, I do not want to be like Queens. I watched the CNN special of, I think it was Brooklyn Hospital last night. It's a good special. It is bad. It is bad to see what's going on. So let me get to some of these questions. Someone wrote, what is the most common culprit for springtime allergies? Supposedly that's from TJ, who is my son, who's 8, so that might be my wife, but I like that plug. I like that plug. So anyway, what's the most common culprit in the springtime? In this area, it's birch and oak. So go go, I'm going to give a plug to some other guys. Atlanta Allergy has a pollen count. You go to the pollen count. It tells you the numbers. It'll be high, very high, medium, or low. If you look at them, birch and oak make up most of them. Birch and oak make up most of them. The thing is, you're going to see the green stuff on the floor. That's pine. It's actually not allergenic. It's just what you see. But when you see the green stuff on the floor, that or on your car, on your windows, that means the birch and oak are super high. So that's the one that gets you in the springtime, birch, oak. And right now it's super high. I think last week it was 6,000. But it rained over the past few days, I think Thursday or Friday, something like that. And so now it's not as high. Birch and oak, take your nasal steroids, do the rinses, take your antihistamines, stay away from us, stay away from your doctors. If that doesn't work, call me. I'll give you a virtual visit.
We got a question.
All right, I got a question. Yes, go ahead.
Over-the-counter allergy medicine help.
That's Instagram?
Yeah.
People actually watch me on Instagram? That's awesome.
Yeah.
Or is that fake? But all right, the question is, will over-the-counter anti-allergy medicines work? Yeah, they do work. The over-the-counter medicines are pretty good. They just went over-the-counter probably within the past 4 to 5 years. So this is my rating system. The pills, meaning Zyrtec, Allegra, Claritin, they're like a 3 out of 10. 10 being the most effective, 0 being the least. They're like a 3. Now the nasal steroids, like the Flonase, the Rhinocort, Nasocort, they're like a 5 or a 6. So they work better. So the pills are like a 3. The nasal steroids are like a 5 or a 6. And you can use them in conjunction. And if none of those work or you don't like them, then I think about allergy shots, which are like an 8 or a 9. So that's kind of my ranking tree on where they stand. And you could use the nose sprays and the pills in conjunction. So that's what I would tell you to do if your allergies are doing bad. You can get them from the store, or better yet, get them from Amazon if you can get them. Amazon's booked out. But, all right, and now I got some questions. Wow, I got like 30 people watching me. This is like its own little happy hour. Half of them are my family. So I do got a question from Mariella, a question about milk allergy. My daughter is 3 and never experienced any reaction until now. Small bumps and itchiness after exposed to isolated protein shake, then mozzarella, then does this make her allergic? What sign should I look for? Okay, the question is someone having milk allergy, and it's hard for me to answer that on a Facebook Live group because I need to hear more. But typically a true milk allergy, it'd be unusual to first get that at 3 years old. You probably had milk multiple times before that, so it makes me think less likely. It might be an intolerance or something unusual. Usually a true allergy, like a milk allergy, you'd have nausea, vomiting, hives pretty immediately after eating. So a 3-year-old to be first getting diagnosed, that very unusual. It might be more of some intolerance or some other sensitivity than a true allergy. Her question is, what signs should I look for? Immediate hives right after eating, and it should happen pretty much routinely when eating milk protein. At some point, if you ever wanted to get tested, we could see that come in, but I think it's less likely. Ron, everyone's now giving me typos on what happy hour I should go on. I'm getting Zoom versus, what's the other one that my family does?
Sounds like you just need to go ahead and get Zoom.
Zoom, I guess I gotta get the Zoom. Okay, another question. We have poison sumac, and we are taking, this is a good question. We have from Laura. We have poison sumac, and we are taking antihistamine with triamcinolone and hydrocortisone twice a day. How long will it last? Oh, will I need more medicines? It's hard for me to know how long it'll last. It'll depend on how long you've been exposed to it. I'd make sure you wash your clothes really well, Laura, because that poison sumac can be in your clothes. If you have a dog and stuff and they got in that could even be on there. The allergen on that is usually called urushiol. A good source to read more on that is actually WebMD. WebMD is pretty knowledgeable, actually. I'm not sure, but if you check my website, I may actually have a video on WebMD that I did regarding this. But I like WebMD or Mayo Clinic as my sources. You're on pretty good medicine, triamcinolone, antihistamine. The only thing is if that doesn't work, you'll probably need some oral steroids. So stay with that. I'm going to guess 5 days, 7 days. It's hard for me to say. And then if that doesn't work, give us a call. You don't have to come in. We could do a virtual visit, but you might need some oral steroids if the antihistamines and the topical steroids not working for the poison sumac or the contact dermatitis. I get a shout out. Oh, y'all can't see the shout outs. I got Kim. Kim gives us a shout out. Congratulations on the new baby, Kim. That's one of my MAs has been working with me the longest. She just had a baby. I hope that helps Cindy, what else? Any other question? All right, I got another one from Emily. Their patient did shots with me for years, having a rough time with the pollen and will need to resume shots. He has been taking Zyrtec 10 milligrams twice a day and Rhinocort. We used antihistamines twice a day. He is struggling. Anything else? When do you think it's safe to start shots again? So this is a former patient of mine that was on shots. I hope you're hearing my answer. And so the issue is they were on shots, and this is not uncommon. You get on shots, life gets good, and then you kind of stop it. You may need it again. There's about a shot for 3 to 5 years help, but there are people who stop them and then the symptoms come back. So you may need them again. And so, Emily, what I would say for you is you're on kind of max medicines. You're taking the Zyrtec twice a day, Rhinocort, nasal steroids, the eye drops. I would call us and do a virtual visit. If nothing else is working, I could call you in some Lotamax eye drops. That's a steroid eye drop, which is usually my go-to when the topical antihistamines are not working. And it should work well. You probably need that. And if none of that's working, some oral steroids as well. And then we really should talk about getting you back on shots. The problem is, Emily, for you, or for your son, the shots will take a while to kick in, probably a month or two at best, probably longer. So they're not going to help you for this spring season. So there's no urgency to come in now because they're not going to help you. Might as well wait till after the COVID stuff's done. And they'll help you in the future. But give us a call. We could do a virtual visit and call you in some topical steroid eye drops and a backup of oral steroids just to have, just in case, so you don't have to go to the ER or go to the urgent care, so you have that as your backup. I don't know which way the pollen's going. I'm assuming it'll go up. So just give us a call. We can call you in some. We do a lot of virtual visits now, and we can do that and get you some topical medicines. Hope that helps. Oh, Emily, good. You're welcome. She said thank you. You're welcome.
We got a question over here.
Yeah, go ahead. I got an Instagram question.
Someone asking, does pollen make you tired?
Does pollen make you tired? The answer is it can. If you are allergic, so the question is, again, this is, I was told I'm supposed to announce who I am. This is Tom Chacko. I'm an allergist in the North Atlanta area. If you're on my Facebook or Instagram account, you probably know that. But I'm here more so as a open forum to answer questions for my patients or others, because these are so many common ones that it helps to answer them in a group setting. So the question is, does pollen make you tired? The answer is yes, it can. If you're congested, if you're not sleeping well, you could easily be tired. If your nose is stuffy, your blocked nose, you're sick, you can not sleep well, so you can be tired. B, the third thing is also some of the medicines that you take, specifically cetirizine or Zyrtec. If you're taking that, it's very common in a certain amount of people to make them sleepy. I know my wife, I don't know, Ush, if you're on it or not. If you are on it, Ush, you should have, it'd be good for my parents to see this. But if you are, they like this stuff. But anyway, my wife, Ush, gets tired on the Zyrtec, so we specifically use Allegra. So the answer is, can pollen make you tired? The answer is, in certain situations, yes. If you're congested or some of the medicines, yes. What I would do if you do have bad pollen allergies and you have a side effect of the sedation from the pills, potentially use Allegra and or the nasal steroids. The nasal steroids should not make you tired and work really well. The problem with the nasal steroids is it takes a few days to work, so you got to give it some time before you say it didn't work. It really needs to be in your system for a little bit. Hey, Lilia, how are you? Say hi to Clifford. Guys, by the way, this is my first time actually responding and seeing the messages, so if I don't look that professional doing this, it's because it's my first time. Let me see what other things we got up here. This is a great question. So Sandra asked me, Dr. Chacko, would lactose-free milk help to lessen the sinus buildup secretion? The answer is, I don't know. I don't think so. So the question is, a lot of people, I would say no, Sandra. A lot of people feel like dairy. Oh, my arms are getting tired. It's like a workout. A lot of people feel like dairy makes their sinus mucus thicker. And anecdotally, a lot of people say that. There is no data behind that. So I can't say yes or no to that. So when people ask me, does milk make my sinus mucus thicker? I would say, I am not aware of that data, but a lot of patients feel like that. And so I say, if you feel like that, then you should reduce your dairy consumption. So that's one. The question is, does that have anything to do with the lactose? And I don't think so. I don't think the lactose, if it is the dairy, lactose really gives you more GI issues. but I'm not aware of that giving you sinus issues. So the short answer is, do I think dairy makes people's sinus mucus thicker? There's no evidence on that, but anecdotally, a lot of patients say that. And then for those patients, I say to avoid dairy. Do I think lactose-free milk will make that difference? No. I think lactose will give you more GI issues, but not necessarily. I don't think that's playing a role with the sinus issues. John, if you're still on this, which you might have my allergist friends, you could shout me out and call me out if you disagree, or give me other comments. I'd be happy to hear it. Regina Phillips, I don't know if Usha's watching this or not, but Regina Phillips, that's Usha's homie from back in Philly. Anyway, Regina Phillips asks, what is the difference between Flonase and Nasacort? Stay at home. Oh, good hashtag, stay at home. I agree with you, Regina. They're similar. They're basically, it's like Reebok and Nike. They're all running sneakers. They're the same family. They just have some different. Some people feel like Flonase smells a little different. Nasacort, you might like the feeling of one versus the other. Like Flonase sensimus, I actually like the little bloom of the Flonase sensimus. That it works a little bit differently, but they're pretty much in the same family. And if you ask me, do I use one versus the other? Not really. If I have a sample of Flonase sensimus, I tend to like that. But is it any better or worse than Nasacort? Not really. Rhinocort's another one that's a little bit thought to be better in pregnant people, but pretty much they're all in the same family. Pretty much do the same things with little tweaks here and there between them. Laura asks, how do we set up a telehealth visit? Theo has not had shots for 3 weeks and we're almost out of serum. He's doing well, but wondering if we have lost all the time. No, okay. So the question Laura is asking is her son is here for shots, but hasn't come in for a while. That's okay. If we're okay with spacing out shots a good 3 to 4 weeks, even 5 to 6 weeks. That's okay. But the question is, if your allergies get really bad, which I do have some of them, especially in the springtime, where they need their shots, especially in the spring, then you should come in. If you're fine spacing it out, no worries, and you're not losing any momentum, you could say. So that's okay as long as he's doing well. If not, then you got to come in and maybe get your shot and let us know. You can get, and the question is, how do we do a telehealth visit? Just give us a call, and it's really easy. You literally just click, we schedule your appointment, you click on a link. It's almost like FaceTime. We use a program called DoxyMe. We just click on the link and then you stay in a queue. And then when we're ready to get to you, we'll call you up and it's pretty much a FaceTime visit. But we have your chart in front of you. So I hope that helps. And the question is, another question, it's okay to space out the shots. That's not a big deal at all. Prila, good to see you, man. Thresh in our prayers, and hope your family's in our prayers. I got a big Philly and New York contingency. These are not my patients. These are more my family and friends. So, thoughts and prayers, especially to my New York family. I grew up in Queens. I grew up not too far from where a lot of the stuff is happening. I trained at Bellevue, actually. I went to NYU. Bellevue was my training. So I feel for all those stories that I'm hearing in New York. To assist so Ron is asking me, are there any alkaline foods to assist with allergies? Honestly, Ron, I am not aware of that. I am not aware of certain diets or anything that would help with allergies now. People always ask me about the bee pollen and eating that and if that helps. That's more anecdotal. I don't know of any data on that. So when you ask me, is there any data on diets to help with allergies? Not aware of. If you ask me if you want to do as much natural things as possible, I would recommend using the rinses, the saline rinses, to help mechanically move pollen and mucus out. Christina is asking me, let me see if I can read this right. Do allergies indicate possible immune response that cause an alert for those that may get COVID, as has been said that it uses immune response within the body and allergies are in immune response, are they not? So I think the question I'm getting at that Christina's asking me is, are allergies, like, because COVID is an immune response, do allergies play a role with that? Or are you more prone because of allergies to get something with COVID? And the answer is no, not that I'm aware of. I'm not aware of allergies and COVID playing a role or you being at a higher predisposition for that. So I'm not aware of that. I would imagine if you have allergies and bad asthma and your lungs are a little more brittle, then yes, COVID can get you a little bit more. Oh, good. Lisa Duncan, Linda asked me, what's the difference between Flonase and Xhans? Same drug, different dispensing? Wow, that's a good question. Taylor, do you know Flonase and Xhans? No, okay. So that's a good. So Xhans is the newer fluticasone nasal spray. The difference is the way the Xhans works is the device that they use. You blow into it, and the thought is that when you blow into it, it pushes the medicine into your sinuses more than using just a regular Flonase. Because if you do use Flonase, you can see it drips down your nose a little bit. So the Xhans may deposit the nose spray better and make it more effective with the pressure and the blowing, and it blocks the area from you losing it. It's been indicated for bad polyps. I haven't used it much, although some of my doctor colleagues swear by it. I feel like it's significantly helpful, especially for polyps. Same medicine, it's really the device, and the device deposits the medicine better, and so it works better. Hope that helps, Linda. It's the device and the way it deposits in the sinus. It's supposed to make it more effective. Kim's asking me a question. Kim, you work with me. What kind of question can you ask me? But not sure if you ask. But are you taking precautions for telling patients that are coming into the office for shots and visits? Yes, I am taking. Kim, yeah. Kim just had her fifth baby, right? So we talked about that, about using the drive up. We're asking everyone to wear a mask. We take their temperature before they come in. And we're trying to minimize people in the waiting room. So yes, we are taking the precaution. I'm not gonna lie, I'm not trying to minimize this, but I am scared of COVID. If you are not, you're not taking it seriously. And I'm not trying to bring anxiety about. I'm just trying to tell you the truth, man. Again, just look at New York. We don't want to be like that. So we are taking precautions, and we hope that everyone else is as well at home. Pre, you're asking me on Facebook. We text every day, but okay, good. I like the question. Pre asked me, does saline adversely affect people with high blood pressure? Causing blood pressure to increase. The answer is not that okay, Pre. So the question becomes, we often give people saline in the hospital to increase their blood pressure. It's fluids, right? They're hypotensive. And so they get fluids to raise their blood pressure. That's a common thing we do. But in regards to saline that I'm recommending in the sinuses, it's not going to affect your blood pressure at all. It just cleans you. It's literally like dunking your head in the ocean and getting the salt water and cleaning out your sinuses. And it's proven to decrease the amount of pollen and help you clear sinus infections. Did I get everything? I'm going back. I might have missed some. Christina gave me Ron, Pre, Laura, Regina. You got anything on yours? No. Trying to see anything else. Do you recommend? Oh, someone else got me. Julie Hayes is watching. Julie, I hope you're doing okay, Julie. I don't know where you are now, but Julie, I hope you're doing well. I hope life is good. You know, I always was fond of you. A great person. So Cindy's asking me, do you recommend the power nasal irrigation kits? So Cindy, you're hearing that I'm telling you these rinses are really good. The issue is however you get it up your nose. I don't like the neti pot because it uses gravity, right? So you go like this. It's hard to get up here and your sinuses are here. I like something with pressure, something that you squeeze. We use a Neomed rinse. I like the irrigation kits. Those are great. It's just something that you use that gets pressure to go up this way and this way versus like gravity. It's hard to get gravity up here. I hope that answers your question. I'm going backwards. Cindy, I hope that answers your question. The answer is yes. Do I recommend the power nasal irrigation kits? Answer is yes, or something with pressure to get the irrigation up there. So Nicole is asking me, my mom, we know your mom, Nicole. We know Linda very well. She's coming to get her shot. Should she come tomorrow? She can't figure out the technology. The answer is no. If she's okay, I guess she's trying to do Facebook. Don't worry, man. I tell her it's okay. This is my first time doing it. Nicole, it's okay for her to hold off on it. I know your mom well. If she's doing stable, she could skip. No worries on coming in, and we could do it in 2 weeks or 4 weeks. It's okay. I'm pretty sure she's on maintenance, so I think we could wait on that. Again, you don't have to come in for a shot unless things are worse now, or unless you're feeling worse now. So Shelly's asking me, have your thoughts changed on daily preventive medicines for asthma due to COVID? Her son hasn't needed anything since March. Is it okay to stay off everything? Great question, Kelly. I know your son well, and the answer is, can you stay off of it? The answer is, you can see I'm hedging, but I think if he's fine, and I think if his spring is fine, we could hold off on it. But at any point, I would have a low threshold. I would have a low threshold to put him on the controller medicine. The thing is, I don't want to guess, man. I'm okay with a little topical steroid to keep things under control, versus the topical steroid is very safe. And I don't want asthma getting flared because I don't want you guys going to any urgent cares or anything like that. By the way, any of my patients, if you are sick with allergies or asthma, you do not go to the urgent care. If it's not immediate, if you can wait at least a day, you call us, we'll get you in, or we'll do a virtual visit. I don't want you guys, I don't want y'all going in, and I don't want the urgent cares or other people being overwhelmed as well. Most of the stuff we could do on a virtual visit and do some steroids. So, Shelly, I hope I answered your question. I'm okay with Aiden holding on it, but I think I'd have a low threshold to put on the topical steroid if any minimal symptoms. So, Miss Sad, hey, how are you? From Johns Creek. With that, asked me, how often do I recommend doing the powerful irrigation kits? As often as you'd like. It's just cleaning. It's just cleaning your nose. It's like if you took a shower twice a day and snorted up water and got it out. It's just cleaning. At least once a day, maybe. If you do it twice, totally fine. Pollen's really bothering you, do it more. Like I don't do it, but when my wife is sick, when Ush is sick, she uses the Neil Med with sinus stuff to get that stuff out. I don't do it that much, but I just don't do it that much. I don't have, luckily, hopefully, I don't get sick that often, but we'll see. God willing, thank God. I don't want to act like it's, might be jinxing myself. Let me see, what other questions do I have? Any other, I answered Shelly's, I answered Cindy's. I want to make, these guys started coming in pretty quick. I answered the one about local honey, which I said I don't think, there's no data on it helping. It's more anecdotal. Everyone said, I'm not aware of that. I don't think it hurts, but there's no data on that. Someone else, anyone else? Oh, dang, Sandra, I was just, Sandra popped up again asking me, what about local honey? Yes, I'm getting to that. But yes, no data. I don't think it hurts, but I'm not aware of it helping. Would I have my kids do it? No. Do I think it's any harm? No. Just depends. Let me see. Taylor, how long have we been doing this for? Let me see. I got 78 people watching. Man, that's the most people ever.
About 30 minutes.
I feel like we should pull out a drink. and make this like a true happy hour. There's half my cousins on this. No, but in all joking aside, I'm hoping that my New York people are especially doing really well, especially my New York family, but my New York health guys who are doctors and nurses families, I'm hoping they're doing well as well. For you guys, my parents they came to New York in the late 70s, I think. I was born late 70s. I grew up in Brooklyn. I was born in Brooklyn, grew up in Queens. But anyway, my point is that we have a lot of family that work at hospitals in New York, and the stories they're telling me are really bad, really, really bad. My mom just told me about someone they know that's a 21-year-old kid that died of COVID. So we're thinking it's only older people, but it's not. It's not. So don't think of it that you're younger and you'll be okay. Think of it, take this very, very seriously. What other, Chris? Hey, Chris, how are you? Carson, is he doing okay? Yes. Man, I'm glad he's doing okay. Hold off on the shots unless he does worse. Come in every month to every 6 weeks. That is totally fine. As long as you're doing okay, you could space that out. Y'all don't need to come in. If things get worse, if the pollen messing them up, then you let us know. Someone else, Shelly, offered the happy hour. That's good. I'm not sure if I'm allowed to say that. This is professional. Michael, though my staff is doing my staff is doing okay. Honestly, how's my staff doing? That's a great question. They're doing okay, but I think they, rightfully so, are a little nervous. I'll tell you the truth. We have a small staff of about 10 people, but we've had 2 people leave within the past few weeks because they they were nervous about it, and that's okay. We have one person working from home because she's nervous about coming in to see patients, and that's okay as well. So when you ask how's my staff doing, I thank Taylor and everyone else for being here, but I think for everyone this is a trying time. Everyone's a little nervous. I'm glad and blessed and lucky, and I thank God that we're all healthy and they come in. But if you're not nervous, you might be taking this too lightly. So Michael, in a long, and that was I don't know if anyone can see, if Kim, I don't know if y'all can see the messages popping up, because I'm not sure if I'm allowed to say the last names. Can they see the last names?
Yeah, they can see.
Okay, that's Michael Dome. We know that's family for years, and Kim, you're on here too. That's Michael Dome. Thank you for asking. That's very good. They're doing okay. And Michael, I don't know if you know Kim, but she literally, and most of your guys on my staff, most of my patients, y'all know Kim because she's been with me for over 5-6 years at least. But she just had her 5th baby and everything's going well. She had it, what day was it? Friday night? Friday or
Saturday.
Kim, you can give me a shout, Friday or Saturday. So blessings to Kim and her family. But she's doing well. I know a lot of my patients have asked about her. Great question. How are you sanitizing the rooms for patients, Nicole asked me, that do come in? So every time we move, first of all, we don't have that many patients coming in. That's the first thing. But when we rotate the rooms, we try to have minimal people in the waiting room, A. And then B, we're wiping them down with wipes after each patient. So we're wiping them down. We're all wearing masks. I know it sounds crazy, but I suggest you guys wear masks too. It doesn't protect. The mask will protect the other people. It doesn't necessarily protect you, but I think it might naturally make you touch your face less. And so we sanitize afterwards. We're washing our hands often, both to protect you and to protect us. So Nicole, I hope that answers your question. And we're trying to minimize. Oh, good, I got thumbs up, so I'm assuming I answered your question. And Shelly gave me a thumbs up too. Got a lot of thumbs up. And so. I hope that answers your question. But honestly, Nicole, we're just like you guys. We want to stay safe. We want y'all to stay safe. So we're trying to do everything for both ends, us and you guys. Hey, Mr. Aditi's mom. I hope Aditi is doing okay. I usually see Dad, but hope you guys are doing okay. All my patients who are doing the food allergy treatments with me, feel free to let me know if any issues. Make sure you keep us posted. So Kenzie is writing, my husband's eyes have been bothering him like crazy to the point where it keeps him up at night. Yeah, good. No COVID. That's good. What do you recommend? He can't even go outside without basically crying. Okay, so Kenzie, hear me. I want you to hear me on this one, because that's very, very, very common for these high pollen counts. Very common. What I would recommend, and there's not, you can't do anything in regards to avoiding the pollen, right? Try to stay inside as much as possible. Watch the pollen counts, try to go out in the evenings versus the daytime. But in reality, over the counter, you should try Zadidor or a Ketotifen, Zadidor, that's the brand name. Ketotifen is the generic name. Get that from CVS or wherever. Try that first. That's like a Band-Aid though. I'm not sure if it's going to help or not. I would try that first. If that's not working, give us a call. We could call you in either a certain type of eye drop, Patanol prescription eye drops, and or topical steroid eye drops. Usually the topical steroid eye drops is what I do at that time. He'll get better if he does that. That should work. But you might need some prescription stuff. And if you need us, give us a call. We could actually do that virtually. We could do that, or my nurse practitioners can do that. Try the over-the-counter stuff first. I am not sure if that's going to work, but we can try it. You can try some antihistamine as well, like a Leg or a Zyrtec. I'm not sure. You might need some stronger stuff, and you might need more prescription stuff after that. Kenzie, I hope that answers your question. Watching. I guess the other thing is they got nowhere to go. What else are they going to watch? They're doing nothing. So Melissa wrote, and I'm opening her up. My last shots were 5 weeks ago. Can I skip? How long? An allergy to pollen and infection. That's a little tricky. I would have said you could skip, and that's okay, unless your allergy is doing worse. You might need that. Oh, Mina, can you not hear me? Can you?
Finger.
I'm sorry. My finger might have been on the sorry guys. I apologize if you couldn't hear me. Thank you for letting me know. Thank you for letting me know, guys. I didn't realize my finger was on the voice. All right, now we're better now. This should be better. Thanks, Chris. All right. Everyone's telling me they can't hear me. Now can you hear me? Better now? Thank you. That was me. Again, first time. My finger was covering it. Thank you. All right. Dang, I must be talking for a whole long time without you guys hearing me. I apologize. So let me go back to Melissa. Melissa, so the issue is, can you skip the shots? I would say you could skip it, but I'm a little concerned that you're skipping it now in the money period where the shots would be the most effective. Because I think it's already 5 weeks. We probably need you in because you're already telling me your pollen's getting affected. And I don't want you getting sick because of the allergies. What I would do is I'd probably come in and get the shot because I think you need it. Again, we're doing I get that we don't want you coming in. We want you staying home. What I would do is just have you come in your parking lot, text us when you're here. We'll text you to come up, get your shot out. Ideally, you're in and out of our office within about 5 to 10 minutes. So that's what I would ask. Some people, you could tell, I just told Carson, you guys don't need to come in because he's fine and he's gotten his shot, he's doing good. Melissa, I would tell you, you probably need to come in because you've been out for a while and you're doing worse. So I think your allergies might get worse if you don't come in. Hope that helps. You guys could hear me okay? Yes, my hand was getting tired, so I held it to the bottom and then that must have been covered the mic. I guess I need to be...
Somebody that might be having a reaction.
Who?
Arden.
Someone here now?
Mm-hmm.
Vicky's out there?
Yes. Vicky is tending to him right now.
I
just wanted me to let you know.
Okay. Let Vicky know. Sorry, we are seeing patients, so I'm just checking, making sure we're good. All right. You're covering your audio. Thank you for letting me know that. We can't hear you. Okay, I got you. Now I'm good now.
That's what happens when you have a lot of people watching.
Is Latika in the Doraville office tomorrow? You know what? They're different practice, so I don't know what they do it as a favor. You'd have to call them and see. Latika, I don't know what hour she's in or not, so you may have to call them and see. Shelly's asking me. I've been given for her son. I know her, it's Aiden. I've been giving him nose sprays and Allegra the past month. If he does start showing signs of it not being enough and yucky cough, would Singular or a daily inhaler be my next one? Good question, Shelly. Depends on what I think the cough is due to. If I think the cough is due to postnasal drainage and congestion, I might do the Singular. If I think it's more coming from the chest, I might do the Qvar or the Flovent or whatever you have at home. It kind of depends on what I think. You can go either way, actually. Either way would probably be okay. So I hope that answers your question. I would... If I had to go just off what your text is, I'd probably lean towards the Singular. But it kind of just depends on where I think the cough is coming from. How early should I call to get an appointment for mid to end of May? Are you seeing same number of patients or backed up? No, we are not seeing. You're welcome, Shelley. You just call us when for better or worse. Mina, you said get an appointment for mid to end of May. I think we're going to be in this lockdown situation until at least May. I think April and May. So you can call us. I don't think we'll be backed up. We might start working overtime in June. But even in June comes, I think people are going to trickle in. It's not going to be this big mass thing of everyone going out at once. I don't know if that's going to be the recommendation or not, but I don't see that happening. Do you have something for me, Taylor? You look like you're about to ask me something.
No.
All right, let me see. Did I answer all the questions? I hope I answered the ones that... all right, Hank's doing okay. Good. I'm glad he's doing okay. Thank you so much. All right, good. I'm just going back and seeing if I answered everything. But I'm glad you guys all came in. And I need to tell my kids to stop texting me while I'm doing this. They're asking me if they can give their dog peanut butter. We just got a new dog. I don't know. But I need to know. I need them to know that I'm on this.
I think they should give the dog peanut butter.
No dog peanut butter? I think you can put them in a Kong. All right. I got one from Jake's mom. We are currently giving Allegra, Flonase, for the tree pollen allergy. He seems to be needing Ventolin. Yes, that is too often. He seems to be needing the Ventolin every 3 to 4 hours. That is too often. Yes, that is. For Jake, if he's using if any of you, not just for him, if any of you are using the albuterol or the Ventolin too frequently, that's a problem. That means there's inflammation uncontrolled. That the inflammation is uncontrolled, and you're just using the rescue inhaler to open things up, and so that's not good. And so, man, sorry, I'm getting distracted with all these peanut butter answers. I'm getting all these comments about yes, peanut butter, no peanut butter, yes, peanut butter. So I know peanut allergies. I don't know peanuts and dogs, so I'm gonna have to defer those. Hold on. So my next, going back to the asthma. In all fairness, if you're using your albuterol frequently, that means you're opening it up, but you're not treating the inflammation. That's a problem. So if you're using albuterol every 3 to 4 hours, it's a problem. You need to be on some controller medicine, whatever that controller medicine may be, either a Q-Raw, Flovent, some controller inhaler. That's a sign that using albuterol too much is not good. So the answer is that is too often. And for Jake, he probably should be on some Q-Raw or Flovent or some type of controller medicine. Give us a call if you need some. I feel like you should have some at home, but if not, give us a call. Mr. Dome, shot hours are not the same in coming. We've reduced our shot hours. So you can give us a call, but on Tuesdays, they're like from 12 to 2, very limited time. And then on Thursdays, it's longer, from 8 to 2, right? I'm looking at my Taylor, making sure. So 8 to 2, and just text us when you're in the waiting room, in the parking lot. And then we'll just tell you to come in. So I hope that answers your question. Some dog comments. Dogs do love peanut butter. No on the peanut butter. We got a Kong. Can't we use a Kong? You don't know what a Kong is.
It probably depends on the dog.
The dog's a mixed lab. Another dog's only peanut butter, natural, no sugar. All right, this distracts me. I got to get back to asthma question. Sorry. All right, let me get back to the asthma. But thank you for the comments. But I got to read that later. I'm keeping up with my shots. I've used my antihistamines. What else would you recommend to protect my lung and lung function at this time? I do wear, all right, I take an antihistamine. I'm using my inhaler and nebulizer. I have terrible bronchospasm. What else would you recommend in order to protect my lung function? I do wear a mask. I think the new system for calling ahead and coming up a shot is very great and responsible. I feel very safe when I come in from that. I'm glad to hear that. Christina, I think regarding what else you can do, I think you're probably doing everything. I'm not sure what else you can do regarding that. I will say don't be too scared about being outside. Get some fresh air. Maybe go in the evenings for walks versus the mornings. I do say people walking, being outside does help the lung to grow. And Omni's asking me, with the increase in pollen, do you suggest anything more than Zysol? Yes. Nasal steroid. I would do the rinses and nasal steroids, Omni. I'd add that. Remember, the Zysol, the pills are 3 out of 10. The nasal sprays are more like a 5 or a 6. So I make sure you do the Flonase. Hey, Leather from Dallas. How are you? Lots of good. I got like my whole old ICA crew, right? All my old New York people here watching. Michael, thank you. And I will tell Amanda, she says, you say hi. She is now working. She works with us, but she's part-time working, actually helping in a jail as a nurse. Amy's asking, if I usually get shots incoming, is it okay for me to go to Johns Creek instead this week? If so, can I show up or do I need an appointment? So, Amy, you'd have to call our office. That's an important question because we leave your medicine in a spot, so we try not to move it. So your serum that we give you your shots would be in Johns Creek. Hey, Lila. So your serum would be in in Cumming. So we would have to move it to Johns Creek, and we try not to do that too often. Also, Johns Creek, we just have very limited hours, probably about 8 to 10:30. I would probably recommend staying in Cumming if you can, because there's more hours, unless you think permanently you're going to be moving to Johns Creek office. Then we can move it and leave it there. We try not to move it from office to office because inevitably that gets left somewhere. If you do really want us to move it, just give our office a call and we can, but we just try not to do that too often. Let me see, anything else? Hey, Leather, how are you? Hope things in Dallas are going okay. I know you're seeing all the stuff in New York, so praying for everyone in New York. I think I answered those all. How long have I been doing this for? It's been a bit.
About 4 to 5
45 minutes is the longest thing ever. I'm sorry it's so long. All right, so with that, I'm going to end it. Again, everyone stay safe. Stay home. Call my office. We'd be happy to help with whatever we can do. And you guys, God bless. And thanks for tuning in. Y'all take care. Thank you. Bye. Finish. All right.